Everybody. I am just waiting to assess a patient who's actually having some lunch. So I popped and had some lunch while she's having her lunch, and then I'm going to go assess her. She's getting induced, so we're just going to check her cervix and see what the plan is. But I thought I'd pop on and do a quick live. We had a few questions around pelvic organ prolapse. So I thought I would do a quick live around pelvic organ prolapse. We always have lots of questions around this, especially in kind of those early postpartum few weeks. So why don't we kind of get started? But pelvic organ prolapse is essentially when your pelvic organs, i.e. your uterus, cervix, and part of your vaginal wall, descends down into your pelvis. These are usually very well supported. However, there's certain issues that can come up that can cause that support to decrease. And one of those is pregnancy, and specifically vaginal birth has a higher risk of pelvic organ prolapse than cesarean sections do. So the musculature, the soft tissues, the fascia, even the vaginal wall provides support to our pelvic organs, to our uterus and cervix. And so if those have been stretched or changed, i.e. lots of pressure with pregnancy or pushing a baby through those organs, you can have descent of your uterus and cervix. And that's essentially what pelvic organ prolapse is. They can grade it on a scale of 1 to 4, 4 being very significant. You're almost coming out of your vagina. This is very rare, especially before menopause. And it can be mild, so a grade 1 to 2. The issue with pelvic organ prolapse is it's really much dependent on your symptoms. So if you have some prolapse but you don't have any symptoms, it's not affecting you, then it's nothing that you need to kind of worry too much about, except maybe in a preventative way. But if you are having symptoms, and most of those symptoms are feelings of pressure, when it gets a little bit more severe, sometimes you can feel your cervix kind of really close to the vaginal outlet, and so then you want to kind of talk to your care provider. The thing about being early postpartum is none of those muscles have been able to kind of heal and get back to their normal strength to support your organs. Just like when you have a baby, your pregnant belly doesn't go back to what it was right away. It takes time for those muscles to kind of get back to their normal shape, get strong again to support your abdomen. The same thing happens with your pelvic floor. So we need some time for our pelvic floor, which has been stretched during pregnancy, and if you had a vaginal delivery during childbirth, to kind of be able to get back into its pre-pregnancy state, just with the length of the muscles, and those muscles need to get strong again. So that's why pelvic physiotherapy is so important, to kind of help manage just your pelvic floor strength. So first recommendation is to do pelvic floor physiotherapy. They're amazing. You can start some simple exercises. If any of you have access to our prenatal class, Mel from Mummy Berries has done like a video for us for what you can start to do for your pelvic floor in those first few weeks postpartum. So if you have that, make sure to go check out that bonus video. It's great. But certainly there's lots of exercises you can start doing that very gentle, even just breathing properly in those first few weeks postpartum to kind of re-engage your pelvic floor muscles. And then, after about 6 to 8 weeks, you can start to see a pelvic physiotherapist if you're kind of struggling with pelvic floor issues or urinary incontinence, which is similar but different. Longer term, pelvic floor physio again is great, but for some people, we know about 30% of females have some element of pelvic organ prolapse, and that can get worse after menopause. So after approximately 50% of people after menopause have it. Some people aren't symptomatic from it though. So if you are struggling with it, pelvic floor physiotherapy is your number one kind of first line treatment and option. And if you're still struggling after that, then there certainly are some surgical management issues that you can do. So pelvic organ prolapse is very common. It's more common after vaginal birth than after C-section. It's more common in people who are a little bit more obese because just the pressure. It's also more common in people who smoke, both because the smoking can decrease the strength of your connective tissue or your fascia, which provides support, and also oftentimes you cough more. So if you cough more, you're putting a lot more pressure on your pelvic floor. So those are some of the risk factors for an increased risk of pelvic floor dysfunction leading to pelvic organ prolapse. So that's kind of the quick and dirty on pelvic organ prolapse. Hopefully that's helpful. But again, it's very common postpartum, and it often does resolve. The estrogen thins out your vaginal mucosa, the tissues that provide support. So once you stop breastfeeding or once your estrogen levels get back to normal, oftentimes that will improve. Also, as you're recovering from your birth, your muscles get stronger and help to support a little bit more effectively. So if you're in those early postpartum days and you think you have pelvic organ prolapse, please do not fret. It will improve. I would book an appointment with a physiotherapist, pelvic physiotherapist, to get assessed around the 6-week mark. But certainly if you're kind of 3, 4, 5 years out from pregnancy, from childbirth, or you haven't even had it and you think you have pressure sensations or feeling of kind of descent of your pelvic organs, please talk to your care provider. And again, pelvic physio is always a great first line option. And then if there's some issues, we can talk about a plan.